Dr. Quinn, thank you for joining us on a chilly, gloomy Friday afternoon.
Hey, thank you for having me.
Now, you've been studying disparities very carefully. What causes them?
I mean, there are multiple factors that cause health disparities in the African American community, but the result is decreased health status, resulting in what you mentioned earlier. According to the American Cancer Society, African Americans, we have a much higher probability of losing our life from cancer and also a much shorter survival period if we have cancer and other medical conditions such as hypertension, heart disease, kidney disease, and so on and so on. But there are many causes, but two of the main causes are social and also health literacy issues. As far as in the African American community, we have less of an understanding of the importance of being proactive with your health, and this also greatly contributes to these health disparities.
Now, you talk about the disparities. What are some of the barriers that result in these health inequities among African Americans in particular?
Well, I'm going to read you a statement from the CDC. It talked about the social factors that I mentioned earlier. It noted that in the statement, there's a higher percentage of individuals with higher unemployment, living in poverty, not owning a home, cost-prohibiting effects of trying to see a medical provider, smoking, inactive lifestyle, and/or obesity. These are some of those social factors that are much more prevalent in the African American community that result in these decreased health outcomes. But also, I noted health disparities contributed to by a decreased health literacy, meaning that in our African American community, we don't have the same information that the other communities have at the same amount, which results in us making decisions that are less informed, that are not to our best interest.
You talk about the information getting. What are some of the solutions to this of getting this information that we need to get to people?
I'm so glad you asked me that. There's a lot of exciting programs that are going on right now, all the way from the national government with the NIH and just the White House, all the way down to the local government with the Mississippi State Department of Health. Our clinic, along with a lot of the other healthcare providers in the state of Mississippi, work very closely with the Mississippi State Department of Health. Our health officer, Dr. Thomas Dobbs, is awesome, but also working with Dr. Victor Sutton, who's over preventative medicine for the state of Mississippi, many programs such as the pre-diabetes program, which is a federal program that's worked through the Mississippi State Department of Health, where we work with individuals to teach them healthier lifestyle choices, with different programs where we help people get their weight down, people that are pre-diabetic, helping them to avoid diabetes, but also initiatives such as the Chronic Care Disease Initiative that we participate in, where we actually went to a nightclub. It was covered by your news station, and we set up a booth and we go on stage every 10 minutes and give out prizes like gift cards or even a bottle and educate people about the risk of sexually transmitted diseases and encourage pap smears in an effort to decrease contracting STDs and also decreasing vaginal cancer. So these are just some of the solutions that are ongoing, and we just have to keep these solutions going and stay optimistic.
I'll make one comment because we don't have time to talk about it, but I was really impressed at the churches that took part in so much information, spreading information and getting out vaccines during the pandemic. So anyway, that may be a solution to getting information out too. Dr. Quinn, thank you for taking time out on your Friday afternoon for being with us here.
Hey, thank you for having me.